So now we are going to ask Muriel to join us. So Muriel actually has done this already twice, right, Muriel?
I want to say at least twice.
Yeah. So I remember one in 2020 and then one a couple of weeks ago. So thank you for joining us again. So our goal for the next couple of weeks, take the SPM, we say SPM, and if you can just elaborate those when you start, different modules of SPM and how we are utilizing, and we are the only one in the country who are authorized to sell SPM. SPM is a practice management software through Cerner, via Cerner. So we have a partnership with Cerner. And it's important for our client and prospect clients to kind of understand how we are utilizing it. And I'm hoping that it can be beneficial for those individuals, those practices. So, Muriel, I'm going to ask you to start.
Okay. Thank you, Kamal. So as Kamal mentioned, I would like to briefly go over the collections module in SPM. It's a tool that SPM has that helps the practices categorize the patient balances into different categories. So the reason for that is because it also helps with the revenue and the collections. So I would first like to just talk about a few of the main functions that we use, and then just elaborate a little bit more on that. Kamal, if you would like to go to one of the slides. So this area, this aging area, is part of the collections module, the collections maintenance we call. As you can see, there are different parameters that are used to determine at what step does a patient balance enter a different aging category. And depending on the aging category for that patient balance, then the system determines whether it goes to the final collection step or a pre-collections process. So this is just an example. I created this little snippet as just an example of some of the parameters that we have across the board for our ACO clients. And basically what non-collections means is the balance is not going to go into any kind of collection step as long as there is a sufficient payment, or if there's an insufficient payment or no payment. Whenever it says non-collections in each of these areas, it means it would not go into a collection step. Collections just means basically that at that point, depending on the category, then the patient account will show up on the collections report. And then I can go into a little bit more detail as to what sufficient payment and insufficient payment means. So this next slide, it represents the payment details. And this is what determines what a sufficient payment is or what an insufficient payment is. So in this case, just for an example, let's say the patient's balance is $50. Depending on these parameters, the patient needs to make at least 25% of that $50 payment in order to be considered a sufficient payment. If they make anything less than that, then that would be considered insufficient payment. And this is where the aging parameters of the aging categories come into place as well. For the next example, let's say, for example, the patient's balance is $200. Based on these parameters, the patient would need to pay at least 20% of their balance to be considered a sufficient payment. As long as the system considers it a sufficient payment, they will not go into the next collections process. Kamal, if you would like to go to the next slide.
I was just going to say, we are able to actually set these up based on how our clients want. However, we do provide some standardization so that there is a proper way of using this, so it's not varying from, you have about 120 clients in there. So those numbers, so then those clients don't have to make decisions, so we can actually guide them with those decisions. So that's kind of like what I wanted to say.
Exactly. And then these parameters we have set up across the board for our UMACO providers. Now, this next little slide, I just wanted to showcase part of the collections module, which we call the collections mapping utility. Basically, what this process does is it categorizes the balance into whether they're going to go into the collections list or not. So again, this is just an example of the standard that we have for our UMACO clients, the providers. Basically, what this means is the balances that are 121 days and older, they will be transferred over to the final approval list, which means they will be transferred over to the collections list. And as Kamal mentioned, of course, each client can have some kind of feedback on what they would like in terms of these different mapping definitions. However, we do have a set process for our UMACO providers just to make the workflow easier for them, to help them determine which patients they would like to proceed with collections or not.
So, Muriel, this is one part of the SPM module. So then once we take the client, once we process this, we work with a collection agency because we do not actually do that service. So that's someone that we work with. And if you don't mind just mentioning that company.
Yep, so the majority of our, or all actually, I should say, of our UMACO providers that participate with the collections process, we use Waterfall Revenue Group as the collection agency. And they're the ones that actually work the patient accounts that are approved from the client. They send out notifications, they do the calls to the patients, and try to get them to pay their balances. But we also do work with several other agencies across the board nationwide. But our main one for our UMACO providers is Waterfall Revenue Group.
All right, so thank you, Muriel. So next week, I believe Carlos is going to join us, and then after that it's Besta and it's Richa later on. So we are going to take different modules and then explain these and how our clients are using it. And also, it's probably helpful for our patients to understand what the process is. We don't want anyone in collection. We try to help them as much as possible. As long as there's an effort to make payments, our recommendations to our clients is not to go through the collection process.
Exactly.
But of course, there are times where they can't do much. So, and then there has to be an effort because we also need to respect and value the time that our physicians are doing with their practices. So this is part of that process. And Muriel, thank you again for joining us.
No problem. Thank you for having me, Kamal.
Of course, anytime. Thank you.
Thank you.